what's the basic model that you're using?
So I would say mine is just sort of a traditional direct primary care practice. So by that, I mean 500 to 600 patients is probably pretty typical, somewhere between 500 and 700 patients. A monthly fee that covers any clinical care that I provide. So that could be a traditional office visit. It could be a virtual visit, Zoom, like we're doing now. It could be a house call. It could be a phone call. It could be a text message. So any professional services that I'm going to provide to a patient are included in that monthly fee. And the monthly fee is, I would think we would call it affordable. Now, everybody's got a different idea of what's affordable, but I think most direct primary care practices, on average, if you look at different age groups, probably about $75 a month, thereabouts, for comprehensive primary care. And then as far as the model beyond that, most doctors try to provide extra value on top of that if they can. And I talked about some of those in our prior interview, where we take advantage of things like physicians being able to dispense medications in the office and offering that as a value to patients, because we can purchase medications wholesale and dispense them in the office, save the patient going to the pharmacy and paying a marked up price for the medication. Most direct primary care clinics also find a local lab that they can establish a relationship with so that they can get cash price labs at a big discount for their patients. So that's my model, which is as many things as I can put into the monthly fee, we do. There are things like EKGs and pulmonary function testing, things that we do in primary care that have a little bit of expense for the doctor on the front end, like an EKG machine or something along those lines, but they're not that high. And we've thrown all of that into the bundle of the primary care membership. And then we've, like most primary care clinics that do this, look for any other opportunities to save people money, because, the reason that we're doing direct primary care is to offer like a more intense level of care, which is a time component, but then also affordable care, because we want patients to get both while we're at the same time being satisfied with the job that we have.